patient. The idea of apnea test is we indirectly will prove that when the patient's respiratory efforts are nil, there's a gradual rise in the CO2, and if the CO2 rises more than 20 in 10 minutes, then patient is apneic. That means patient is brain dead as the respiratory centers are not working. So the prerequisites before doing the apnea test is patient has to be euvolumic. There shouldn't be any hypotension. Temperature should be normal. CO2 should be between 35 to 40. And in order to maintain that CO2, we can temper with the respiratory rate by either increasing or decreasing the respiratory rate so that the baseline CO2 should be around 35 to 40. So even if there is a hypertension, as you can see the BP is normal in this case, but in case if there is a hypertension, we can start noradrenaline drip to maintain a blood pressure. And if required, we can escalate the noradrenaline drip during the apnea test also. So if the temperature is normal, CO2 levels are normal, hypertension, BP is normal, then we can go ahead with the apnea test. First, we'll pre-oxygenate the patient with a 100% saturation by a catheter, or we can increase the FiO2 to 100 and pre-oxygenate for some time. This is mainly done because during the apnea test, we do not want any desaturations. So, after pre-oxygenating, we'll take a baseline ABG. As you can see, this is the baseline ABG, and you can see that CO2s are normal. Pre-oxygenated oxygen is almost 399. Blood pressure is without inotropes is 124/74. So this patient is fit for the apnea test, and we can start the apnea test. So, what we do in the apnea test is we disconnect the patient from the ventilator, and we insert a catheter, and we instill the oxygen at 5 to 10 liters of oxygen per minute so that the saturation is maintained. During the apnea test, if there is a BP fall, we can always start a noradrenaline drip, and after the disconnection, we'll see the respiratory efforts and a fall in BP. तो डिस्कनेक्ट कर दो और उसको इंस्टॉल कर दो. इंस्टॉल कर दो. So now the
काटना पड़ेगा बीच में.
We are disconnecting the tube. We are inserting the catheter. We have to make sure that the saturation doesn't drop, and we see for the respiratory efforts. During the apnea test, we wait usually for the 10 minutes. If before 10 minutes, if there is a desaturation or a hypertension, we initially try to maintain the blood pressure with noradrenaline. But still, if there is a persistent hypertension, we'll abort the apnea test. And before aborting, we'll take an ABG to see if there is a rise in the CO2 by more than 20. If there is no desaturation or hypertension, we extend it up to 10 minutes, and we can also extend up to 15 minutes if possible. So as you can see, there is no desaturation or hypertension. So we'll try to extend the apnea test till 10 minutes. As you can also see, there are no respiratory efforts. So now the 10 minutes are over, and fortunately there has been no BP fall and no desaturations. So we can extend by 5 minutes further, or else we can take the sample and we can see if there is a rise in the CO2 levels. We have taken an EVG. The EVG shows a rise in CO2 by 20. For a male patient, for an adult, one apnea test is sufficient to declare the patient as brain dead. For children, we can do a repeat apnea test after 12 hours to confirm the brain death.